Well, welcome everybody. Welcome to our Cisco Theater. You know, zero trust is a critical component to every organization's security strategy. But how does it extend to connected devices? In this session, you're going to gain some best practices to accelerate zero trust for connected devices using Ordr and Cisco ISE. And here to tell us all about it are Marlon Harvey and Chris Sullivan. Marlon is the principal architect, CX Healthcare Practice, Cisco, and Chris is the global alliances leader for Ordr. So please join me in giving a rock star welcome for Marlon Harvey and Chris Sullivan. Let's hear it for them.
All right.
Thank you. Good afternoon. Welcome. Chris and I are going to share 4, maybe 5 things hopefully you take from this conversation. Everyone has heard about zero trust. Everyone has heard about segmentation. Everyone has heard about cyber risk, right? Everyone has heard about software bill of materials from a federal compliance perspective. Today, what we would like to do is actually qualify and validate why a partnership based on a platform approach between Ordr and Cisco is how you should consider addressing these risks and these challenges in healthcare. The second thing we're going to focus on is the benefits associated with taking that approach and then informing and curating an architectural strategy to building out the right policies and the right infrastructure to avoid the risk that comes from actually having to manage medical devices, the adoption of Internet of Things, the adoption of Internet of Medical Things, the provision of a distributed environment. The third thing we're going to do is actually share with you an architectural framework. And then lastly, we're going to actually emphasize a number of use cases that a number of deployments have been leveraged already to address. And if we have time at the end, I'll share a bit with you about what the CX healthcare practice is from Cisco. If not, Chris is in booth
4032.
432.
It cut out.
If you'd like
4332.
And if you'd like to hear more information, just please come to the Cisco Secure section in this space and we'll be able to share more with you. So, Chris, help us understand why this platform approach makes sense.
I'm going to stand over here, Marlon, if it's all right. So, folks, thanks again for joining us. The reason I have my phone here is I want to share something a very wise person mentioned. First of all, does everybody kind of know what Cisco ISE is or what it might do? Network access control. So we can kind of make sure we make sure that the devices talk to the things they're supposed to. And I'm going to read this, so bear with me. Successfully deploying ISE policies requires 2 things. Knowledge of precisely what a device is, and a complete understanding of everything a device does. If the first is wrong, then the wrong policy can get deployed. And if the second is wrong, then critical traffic, especially in your line of work, right? Critical traffic gets blocked. Those are things we don't want to happen. But in either case, enabling ISE policy, you want to make sure that that doesn't harm your help desk by doing a lot of erroneous type of alarms. So what does Ordr do and how do we help Cisco? Well, we do those 2 things, quite simply. And you can kind of see from left to right, our marketing tagline is see, know, and secure. Our CMO is back there coaching me up. We want to make sure that you understand everything that's on your network. This is a particular example where this particular customer had 9,000 Win 7 devices. All right, so that's a lot. And for those of you that don't understand why that's a big deal, you don't want those on your network talking to other things because they can be quite vulnerable to attacks. And that leads into our know phase, which is mapping all of those communications so we know who's talking to who, what machines are talking to what machines, and we're going to establish a risk measurement or device risk rating. And then finally, something very, very unique to Ordr, this proactive security. We help network access control products, our main partner within the space is Cisco, by creating policy and automatically putting it into the ISE platform. Those of you that have worked with ICE know that that's a really, really hard thing to do. And we're here to really help automate that motion for all of you and for Cisco. With me so far? So when you think about the joint solution, what does Ordr bring to the table? What does Cisco bring to the table, right? We're talking about things like the whole hospital. So IOMT, operational technologies, so your buildings, your cameras, things of that nature that might not be directly medically related, but also traditional IT devices. So you can see really everything that's on the network. You're going to get an accurate classification right out of the box. And the things that we might not have seen before get device typed very quickly. And then with Cisco, right, you're going to get this joint solution, right? We're going to get a real-time device inventory. So we've got to hook into ServiceNow and Navolo. And you can see the other things, really the business goal, right? Reducing risk and improving patient outcomes.
Hey, Chris, before you move on,
Yep.
I think there's one area of interest that we see gathering is in the notion of device utilization, right? If you think of what happens in a healthcare environment, sometimes there's hoarding that occurs. Hoarding results in a lack of awareness in terms of, I know we spent, X number of the budget last year to buy 1,000 IV pumps. But for some reason, we keep hearing every day the staff complaining that they can't find these devices. 10% of them goes missing, right? So having these devices connected, the ability to actually identify where they are, and then determine are they being utilized effectively, that's a great set of insights that we're seeing emerging in terms of the use cases and the benefits. And that's what the Ordr platform really emphasizes in terms of a visual indicator that shows where are these devices, even though they're not being used, from a location perspective, where are they within your environment at a minimum?
Yeah, I think one thing I would add as well, if you have tried network segmentation or you've kind of gotten a little bit down the path, and it's a hard thing to do, the combination of what Ordr can bring to the table with our out-of-the-box solution, along with Cisco CX, can get you there and get you to that goal, and really get you that zero trust that everybody needs. So we've got a couple of other use cases. Keeping in mind we've got about 10 minutes here, but we're trying to reduce the attack surface. So obviously you've got a lot of things going on in a hospital. You really want to make sure you're controlling all of those communications. Make sure that I know that my infusion pump isn't talking to something internationally that shouldn't be. Hopefully that makes sense. And then really having rapid response to stop attacks before they happen. These are things that are inherent in the platform through a lot of partnerships, both with Cisco and with other companies. And finally, a little bit about the architecture. There's going to be a quiz on this later, so try to memorize this map. I'm kidding. It's a joke. But you can see that we've somebody earlier asked, I believe it was you that asked, where are our partnerships? Where are we working with Cisco? Hopefully this kind of shines through, right? It's really almost everywhere. If you've got a Cisco networking device, if you've got a Cisco Cat9K in your network, if you've got Meraki for your networking or wireless, we're there. Our big partnership, of course, as I've mentioned a couple of times, is with ICE, which is really focused on network segmentation. But really what we're trying to do is both learn from Cisco as well as feed Cisco those learnings in a format which helps solve their security issues. Making sense?
Yeah. So just to summarize what Chris said, it's really visibility. How do you have visibility in terms of what's connected on your network? Number one, it's about identity, right? So identity is not only is it a IV pump that's connected on my network, but it's an IV pump generation X, class Y. And that's where the Ordr platform really accelerates in terms of correlation, right? That IV pump is tied to an application that's running Windows 7 or Windows XP. And the challenge with that is we cannot actually provide a risk mitigation approach in terms of software necessarily. So we have to create a categorization of risk and then surround it with policies in terms of when it communicates on the network, how you then enforce that policy. So we move from visibility to identity / correlation. We then move on from correlation to policy creation. Again, the Ordr platform creates the policy attributes based on its classification and identification. And then we actually have, when there are breaches, we have compromises, we have enforcement. And this is where the Ordr platform in Cisco ISE really shines, is now you have enforcement. So 4 things: visibility, identity / correlation. Okay, maybe 5, I'm counting Canadian. Identity correlation, policy, and then enforcement.
And then a little plug for CX.
Okay, so the CX Healthcare practice is an organization within customer service, and our role is to actually drive the outcome associated with the business of healthcare. Not just the technologies that we sell to you, but to make sure those technologies are being curated in a manner that helps you solve the business challenges that you face when you incorporate the use of digital. Okay, so our practice is comprised of just under 30 individuals. 90% of those individuals come from working in the same environment that you come from, right? Healthcare IT, working in leadership. And we bring that knowledge and that depth of wisdom and share with you in terms of developing your digital strategy, your digital transformation plan, working and understanding how fast can you go and how slow should you go. Okay, so we are available for further consultation. We'll have at the end, some contact information.